everyone. My name is Haley and I'm the Hope for HIE social worker. Thank you so much for joining us today. Today we have Dawn and Matt as our panelists here for our peer perspective panel. So we're going to talk about dental health and oral motor, and I will let them go ahead and introduce themselves and then we'll go ahead and get started.
I'm Dawn. I am the mother of a 12, almost 13-year-old. We're about to embark on the teen years and next week. She has HIE. She went without oxygen at birth and as a result has GMFCS level 5 cerebral palsy, epilepsy, cortical vision impairment. She uses a wheelchair, obviously, has a G-tube. And she also has an amazing smile.
And my name is Matt. I have a 13-month-old who was diagnosed with HIE at birth as well. And I'm also a practicing dentist.
Thank you both so much for joining me today. I'm really excited. So first, I think what a great thing to talk about will be just navigating kind of that first appointment, when that first appointment's recommended, and what kind of things you can do to make, the appointment go well, and then just the importance of the exposure to the dentist office and the staff.
Yeah, so I think this, from my perspective, from a provider, as someone who's new to parenthood and new to having a child with HIE, kind of what we think about traditionally from our own experiences going to the dentist, I don't think are things that we think about when we actually are bringing a child, whether that's a neurotypical child or any child, to the dental office itself. So I think when you have expectations going into the dentist that the dental visit's going to look very similar for you, that might be something that you want to set aside as you think about bringing your child to a dental office the first time. For us up in Massachusetts, and I think it's a recommendation pretty across the nation, is to think about more frequent visits for children. As far as the earlier you get into a dental office, the less challenges you'll face moving forward. So I usually say kind of visiting a dental office by or around age 1 or near the eruption of the first tooth is always helpful to get the conversation going.
And I'll say for us, it's a little confusing when you have a kid that isn't the typical kid that isn't eating, and Emerson's teeth came in a lot slower. She had a pretty significant oral aversion early on in life, probably from lots of suctioning and being in the NICU and lots of, bad experiences related to the mouth. I don't really remember any of her doctors or specialists or anyone involved in her care saying that much about the dentist. And it was kind of, you see the guides for the typical kids and like you go to the dentist here and, and then just I felt very overwhelmed with the idea of what the dentist would look like. She when she was young, she didn't sit in a chair well. She did, not even a stroller or anything like that. She always had to be held. She always had to be moving. She was pretty temperamental. There were just so many reasons that it was very overwhelming to think about going to the dentist, or do we even need to go to the dentist? She isn't getting any food by mouth. All of that sort of stuff. And then where do we go for the dentist? So when we figured all that out, we ended up, our first dental appointment was at the Children's Hospital. And it was a pretty horrifying experience. It was just a very, quick appointment with a not very patient or nurturing provider, someone who didn't know her, and someone who was real comfortable with just letting her be uncomfortable and upset rather than trying to slow down and, make it a little more pleasant experience. So, yeah, it was a little overwhelming. And after that first experience, when I think she was probably about 2, we quickly realized that wasn't how we wanted to continue. So we looked for a dentist that we thought would, maybe be a little less traumatic and work better for us.
And I think that's a really important point from a dentist's perspective to think about, is that the dentist doesn't know your child as well as you know them. So thinking about what makes success, success from a metric of a dentist in my kind of lens from a parent really should mean the same thing, but they often don't. So finding a provider and finding a space that you're able to accommodate and bring your child and feel comfortable is really kind of the number one factor to think about. So if you have the option, exploring, and I think we'll talk a little bit later about this kind of in our panel today, but thinking about what you can do to get to know the environment and get to know what might happen at that visit far in advance of actually bringing your child into a room can better set you up for success. So very often in my practice, if a parent sits on a dental chair with their child in their lap, that can be success. So to answer Haley's question on what what makes a successful appointment or what it should look like, it really should be grounded in the family's needs, and kind of at what metric we find might be a success based on how well everyone in the room is getting to know each other and how comfortable your child is in similar situations. So I think disclosing that information and being and working with a provider that you feel comfortable is really what's going to be maybe the best metric of success in a first appointment. Is that it's a place that you want to go back and it's a place that you trust kind of will continue to meet the evolving needs of your child.
And to expand on that, yeah, that's all great information. I will say my follow-up visit was with a different provider and a dentist that I had heard through word of mouth of other parents that was great with kids with disabilities. And so we made an appointment at that office and it was a completely different experience. We didn't go straight into the dental treatment room. The dentist actually takes you into her office and talks to you and has a conversation to get to know you and just that, what are your goals and what works for you and what doesn't, and all of that sort of stuff. And so actually finding a provider that is willing to have kind of that preparatory conversation and kind of help make things a little more customized to what your needs are and your child's needs are. And it went right to what you said, I held my daughter in the chair for her exam. Everything went slowly and calmly. And if she needed a break, then there was a break. It was a much better experience. So finding that provider that is going to work with you and in the way that your child needs, I think is super key. And they're definitely out there. You just got to find them.
And one of the things that we also, talked about in preparation for this is just ways that you can prepare your child at home for that, like first appointment and then in between the appointment. So I know y'all both have kind of touched on like trying to speak with the staff or maybe, do a tour of the office or get yourself familiar with the office so that you know how to maneuver in the office. And then, so if y'all could just kind of talk about ways you feel like that's successful or some tips for that. And then also ways to prepare your child orally for the exam and for follow-up. So I know we've talked a little about like oral stimulation and gum wiping.
I can share a little bit about Emerson. So prior to going to the dentist, because she did have such an oral aversion, we were always kind of working on giving her a more positive experience and overcoming that oral aversion and just making anything to do with the mouth a very pleasant, enjoyable experience. So, we started out with just literally using like our fingers, to rub her gums and to, clean her teeth and maybe give her little flavors or things that was enjoyable. And she was also doing lots of feeding therapy at that point too, which again was mostly focused on the sensory experience of having things in your mouth and that being pleasant. And so we did a lot of that. And lots of stimulation with, very gentle vibration and other kind of tools that were recommended to us through a feeding therapist. So we were working on a lot of that kind of oral aversion stuff in advance of actually going to a dentist. And then I think one of my key things, we didn't really ever have, we've never done conversations with the provider in advance. other than, just noting, when we make the appointment, maybe, her condition and the fact that she uses a wheelchair and that, she does have some of this oral aversion. And also letting them know, about her swallowing issues and all that sort of stuff as well. So, but I think for us, it's really when you go to the appointment and you're there with the provider, and it can be a little awkward because dentist offices, even dentists who serve, a population of kids with disabilities, they're just not typically accessible places, particularly if your child has mobility challenges. There isn't a lot of room for wheelchairs, and there's usually a big dental chair. So maneuvering around all of that, I feel like you just have to be really direct in terms of like stating what you need and like, this isn't working for us, or can we try this, or can I do this, or can I bring the, all that sort of stuff. So I find that you just have to be kind of very direct and ask for what you need. Because they may not always know, or, your kid best and their needs best. And as I mentioned previously, when she was small, I would hold her in the dental chair, and that would help. And now that she's older and she stays in her wheelchair, and that's a whole different kind of situation in terms of how we access the actual dental office. We usually have to back her chair in so that she's close, her head can tilt back and be close to where the dental tools are. And I am usually a pretty active participant in the dental visit, which I don't think is common, with typical kids, but I'm up in there, I might be holding an arm or holding a head straight, or, all anything that an extra set of hands. There's usually a dentist and the dental assistant, and then, I'm up there helping things as well. So I think just really kind of jumping in and not being afraid and making sure that you ask for what you need and, all of that sort of stuff.
I think you bring up so many great points. I think from a provider perspective, maybe where I'll approach the answer to this question too, but I think having those conversations, whether they're in advance of an appointment and finding a provider that would be willing to do that, I can understand maybe a struggle for some, but it's definitely a good marker of the type of provider that you might want to see, who will work with you and your child to make sure that you're getting all of the services that you need. But really being clear on what's going to work best, and talking through something before you do it. Providers have different approaches to what might be the best to actually get something done when in the dental chair. But as Don mentioned, I think thinking about, well, not only your child better, but the equipment, what they're going to be able to tolerate, signs of distress, and different things. And it might be something as simple as the way that you are facing the child, and making sure the child is seeing your child seeing your face instead of a provider's face for a majority of the visit can actually make a big difference for how comfortable everybody is within the room. So I think asking a provider to say, great, can you walk me through what we're going to do today, even if you haven't had that conversation? And can we think through, okay, are there any other ways to do this? Or is there a way to better facilitate this based on my unique child's needs? I think are great touch points that are really important to make sure you make really clear far before a dentist is trying to look in anyone's mouth. And I think that starts at a first visit, but should continue as we move forward. Now, another point that I love that Dom brought up is thinking that there are a lot of things that will aid your experience in the dentist that you're already doing. Because while dentists typically operate in silos, we rely on a lot of our partners in the allied health professions that you may be seeing with your child for lots of different and other reasons. Whether it's speech therapists, or you're working with different therapies and early intervention services, all of those things that you're probably already doing help and will facilitate making sure that their dental visit is as successful as possible. For really young kids, that can mean massaging gums. I know far before my daughter had any teeth, and for many of our kids, for those who are here with us, probably experience delays and eruption that are typical with the seizure medications that our children are taking. So just getting in there and stimulating as best as you can, but working within the bounds of what you're already doing based on your therapies, I think are really important. For me personally, as a parent now, I think it's been creating a routine. So within our bedtime sequence, I do brush my daughter's teeth. It's now with a 13-month-old, she has, a couple little ones on the lower. But throughout for the last maybe 8 months, as part of the Going to Bed book by Sandra Boynton, with some up top and some beneath, they brush and brush and brush their teeth. I have her lay on the bed, and I'm tickling her more so to make it an enjoyable experience. So I think the ways to prepare a kid at home as best as you can is think about ways to make anything that's going into their mouth or to clean their teeth or to massage their gum as a bonding experience as much as you can between you and your child. Make it as enjoyable as you can, and make it something that potentially you could recreate in a different environment after lots of repetition. Our children are probably all very similar, where change isn't always their best friend. So thinking about things you can rely on or to create a toolkit to make this as, oh, I know she'll open her mouth if I say this certain line and do this funny dance as I have her laying down. And that to me made the first dental visit a little bit more successful in my eyes because she already knew kind of some of the cues that I was giving her as to let's take a look inside the mouth and let's start supporting that. So I think my big takeaway from both a parent and a provider is to try to make the preparation for a dental visit as fun as you can. And I understand that not everybody loves the dentist, even from an adult perspective. But I think selling it as an enjoyable experience and creating some type of system or routine at home will help you prepare a young child. Now, from a dentist perspective, I might think a little differently for an older child where maybe they're able to comprehend a little bit more or know what's happening. We all probably have those experiences when they know when they're walking into certain offices and they know that they're at the dentist as soon as you park the car. So I think that the big piece with that is, building up to that experience, doing things that are related but different, maybe even painting nails or playing with watercolors or brushes even with water, because that might be some of the different tools and textures from a sensory perspective that might afford some success moving forward. There are plenty of play kits out there, or even ways to pretend and play dentists or read books about dentists in advance of dental visits that have really helped me and some of the patients that I work with be more successful when they're actually there. And communicating that you've been doing those things in advance might add another element to our repertoire or chance for us to engage into something you're already doing from a provider perspective to help facilitate that appointment. Now, of course, this is more theoretical than application based, so it's about trying your best too. And I would say give yourself some parent slack as you are preparing for that appointment as well.
Absolutely. Y'all both bring up some really great points and some things to try. The things we want to talk about next is just kind of, we touched on it a little bit, how there's different providers, whether that's speech, feeding, occupational therapist, physical therapist, but just, you can utilize other providers to help prepare your child. So one of the things I do want to highlight is just some of the resources available through Hope for HIE. This is a great area where you can lean into our child life specialist and support there. She works great with families to help prepare your children for medical procedures and, office visits, MRIs, any kind of thing. And so this would be a great resource that if your child is coming, into a dentist appointment or anything where you think that they are going to need some extra preparation, please reach out to Hope for HIE's Child Life Specialist and get some support for you and your child, because we can really help you. And you also have access, anyone in our Hope for HIE community has access to the Child Life On Call app for free. There's information through our website where you can get more, and it does talk about coping and navigating. And I know that this month they will be doing a Q&A with our child life specialist about preparing for the dentist. So please definitely check out some of those resources. And I want to touch on too, I know we talked about just how every appointment is going to look different and what you may expect will happen at the appointment. You may not be able to get a full cleaning or different things like that. So if you could both just sort of share, in those times when you are navigating this and your child may not be able to, do everything you would have typically hoped at the dentist, what does that look like and how do you sort of prepare for that and then moving between appointments?
So this was definitely something we had to contend with. When Emerson was younger, uh, she didn't tolerate nearly as much and not as much time at the dentist. And we couldn't always get everything done that we wanted to get done, but we always opted to stop, to not push her past, and make it a traumatic experience. So, once we had the established provider that we felt comfortable with, she was completely on board with that as well. And so when our approach to cleanings and checkups was, not to go further, and make it trauma. We sometimes we'd slow down and take breaks, but if it seemed like it was getting to a point where Emerson was just over it, we'd say, okay, that's enough. That's enough for today. And we opted to go to the dentist more frequently and for shorter bits of time. So rather than go like every 6 months, we would go every 3 months and just do little bits of cleaning where we could. Now we're to a point where Emerson tolerates the dentist remarkably well and is cool with it. And so, we're able to go every 6 months and get everything done. And she also now is at a point in her where her oral hygiene has gotten really good. She's really great, with letting us brush morning and night and all of that sort of stuff. I will go back to, in terms of preparation, when she was younger, we didn't really talk about going to the dentist other than, okay, we have a dentist appointment today. But now that she's older and now that she's had some, bigger treatments and bigger things that we've dealt with, through her oral appointments, we do tell her in advance and prep her, even when it's something, that is a little bit scary. Prior to her orthodontic adventure, we did have to have some teeth pulled, and we always opted to be very upfront with her and talk about, this is what's going to happen and this is what this looks like. And yes, it may hurt or it may be uncomfortable or, all the different stuff. So, she was 12 when we were going through all of that and certainly could understand. And she's always dealt with it really well. And she's a pretty brave kid and also has a pretty high pain threshold. But it's interesting because some of the stuff that I was most scared about doing, such as getting teeth pulled, was just like a blip on the radar and ended up being no big deal and was fast and easy and recovery was good. And so we've had a pretty good experience with all of that.
And I think kind of the only thing for me to add is to think about, for those of you who have maybe neurotypical children or other children, you know that not every appointment goes exactly as planned, regardless if you're going to a barber shop or to a medical appointment. And to realize that it's very common from a dental perspective to not hit every single benchmark, but you also know your child really well to know what can you do to increase the likelihood of having the most success. So in addition to some of the factors that we were just talking about, some kids using a stress reduction protocol, so going early in the morning, making sure they had their favorite breakfast foods or their favorite TV, whatever they're doing to make their mood and their overall demeanor as best as they can before going to this appointment in that particular day is something that's really helpful to kind of ticking off as many of the check boxes as you can at a dental office, but is about finding a provider that you trust and that has a plan. So for me, in caring for children or caring for adults even, I try not to push past a certain point, and be really open and communicate with them or with their parents about what the expectations are, or and then also talking about what our contingency plan is. So coming a little bit more regularly might be a great idea. It might also be, some children do better in certain environments, with certain caregivers being with them, or even their own certain stuffed animals or different things that are with them. So I think that realizing what you can do to make the appointment as successful as possible is just really important. But realizing that when things don't go past, my big suggestion is keeping it as a positive experience as you can. You are not a horrible parent or caregiver if you don't get to every step in a dental appointment. And then thinking about what you can do to work through it. So for Don's perspective, I don't know, but when I see a patient, I'm not able to do an entire cleaning or I'm not able to check every area in the mouth, or as they get older, take certain radiographs to check for certain things. And I say, let's focus on this side at this 3 months, and 3 months later, we're going to focus on the other. But depending on what we're able to do that day, based on all the other factors that can come into play to how someone is in our chair, kind of go until that point of fatigue is reached, right? So we have a list of must do's or focus areas, but know that there's other things we can do if everything is going as well as possible to kind of until the point where the appointment no longer becomes enjoyable or when that fatigue threshold is reached. And that really comes down to communication. So really finding a provider that's open and creates that type of plan for you, but also advocating for that as yourself as a parent, much like you would in any of the therapies or different things that you already participate in with your child.
I love that. Thank you both for that information. And I want to talk a little bit about too. So I know we've touched on it a little and we've kind of put a little bit of it throughout this conversation, but just a couple things like the importance of explaining to children what is happening, kind of breaking down that appointment in much smaller steps and kind of taking the child through each piece and the importance of that. And then just some of the other things that you were both just speaking about, considering nap schedules, feeding schedules, times of day. So if y'all could just share some of how those have made an impact, what you also feel like are great things to take into consideration when planning your dental visits.
For us, timing is really key in terms of a dental appointment. Emerson has a G tube and gets a feeding, and she, you know, we're really conscientious about when she's getting a feeding compared to a dental appointment. We don't want to fill her full of food and then have a dentist, potentially gag her in an eruption. So like we typically do dental appointments first thing in the morning, as early as possible. That's for her, that's a better time of day. She's in a good mood and she's, not fatigued and tired and grouchy. So we usually give her medications and her water in the morning before we go to the dentist. We go to the dentist, we do the appointment, and then we feed her after, just so for her, that's what works best because she can, be high risk for vomiting if she, is triggered to gag or cough or anything like that. So that's one of the things we do.
And I think kind of again, it's communicating those things because as a dental provider, we do get to know our patients really well, seeing them twice a year or maybe as up to 4 times a year, depending on how frequent they come in. You're the one that's going to be able to guide that perspective. And I think asking that question and saying, well, I want to actually have this conversation about what you think might be best here too, or knowing that they're at high risk for gagging. That's a common thing that we experience in the dental office, but it's not always something that is as clear as one describes because it's very personal to the individual's sense and how everything goes. So really describing that and then asking for similar to what you might do with your child every day as you show them something new or as you build a different skill is tell them about it, show them it, and then do it together and have them participate in it as well. I think can be really helpful. So if you're in an appointment with a parent, maybe thinking it's like, hey, before we do that, can you show them or can you walk through the different steps and can you let them touch the tools? And that's something that as providers we might not always do, but something we should be doing as much as possible, especially as we care for kids that may have diverse needs and that may require different adaptations to different sequences. But again, this happens for every kid that we see in the office, that all of them may be afraid of a spinny toothbrush or a little air that comes into their mouth as we check in dry teeth, especially, for the first several visits with children. I think it takes at least 4 or 5 visits to really get what I would consider a typical or neurotypical child as comfortable as we can to be able to get through a lot of the different elements of a typical cleaning appointment, especially when they come in early and at a young age. So thinking about advocating for, hey, can you show us? Can you show us what it looks like to paint fluoride on teeth? Or can we use it in as a descriptive way? Because you might know their favorite cartoon character or their favorite story. say, oh, that's much like how, this particular character paints all over their or strengthens their teeth. And I think adding those little bits of context that apply to their overall experience in their life and things that they're more familiar with can make the appointment much more successful for them, to get them to kind of to be able to do as much as possible to keep them in their teeth as healthy as we can.
I think that's all so very helpful. And I know we talked about in our prep meeting also about how sometimes in some situations, if it's not, working out as well as everyone had hoped, or if there's a lot going on and the child does have other procedures, scheduled at a hospital, that there are opportunities at some point where you can combine a dental cleaning during another type of procedure. So if you could just kind of briefly talk about that a little bit and what that journey may look like.
I get this question a lot, as I've shared, Emerson's dental orthodontic journey on her Instagram, and I get a lot of questions about, how we go about these appointments, and a lot of people asking about anesthesia and if she has to go under anesthesia for her treatments and all of that. And like I mentioned, our initial appointment was at a children's hospital, and we didn't have a very good experience. And so we opted to go to a private provider that wasn't, affiliated with a hospital. We fortunately haven't had to utilize anesthesia for any of the treatments she's had. But I do think if there was a need for that, combining is a great idea. And we certainly would always, look to do that if we needed to go under anesthesia for a dental appointment or a procedure. Combining that, so obviously do anesthesia as little as possible. But for us, I mean, everything from, the cleanings to the getting teeth pulled to putting on braces, all that stuff we've been able to do without any kind of anesthesia. There is obviously some, I don't know, what did dentists use, Novocaine or whatever the shots are to numb. We've done all that, but she hasn't required any anesthesia, thankfully. So we haven't had to do anything in a hospital environment.
And I think that story is so great for so many reasons, because when you start young and you start slow and you make the dental appointment as positive as possible, the goal is to be able to provide all of the dental services in a traditional dental environment, whether your child's in a wheelchair or we're adapting kind of the way that we are able to use some of the different tools that we use. The best outcome is to be able to provide those in an outpatient setting. But I think it is important to mention, kind of as we think about our children with complex needs, that to make sure it's in our back of our mind, maybe not the forefront of our mind, but to advocate and say, are there any other services that may be able to be done if there's a procedure that's already happening that requires general anesthesia? And all of the children's hospitals that I'm sure would be providing a lot of that care should have departments that should be able to cover some of those services. That may just be a way to help you or to get through a procedure that maybe you're delaying, that would be an adjunct to a lot of the things that you're doing in an outpatient setting already. So just having that knowledge and understanding that you might be able to ask a question that could lead to some really important care, or the ability to access an area that maybe we were unable to access for whatever reason in an outpatient setting due to a severe gag reflex or any of the other variables that may prevent us from being able to provide that care. So just know as a parent that may be something that isn't always, probably because dentists are siloed and maybe even physicians that are caring for our children don't always think of their own dental experience or their willingness to offer that. While there are many out there, I think that having a parent, and I think for all of our sake, advocating for our kids and what we know is best, is definitely what's allowing us to kind of move the needle forward in a lot of different areas. So having that knowledge can be really helpful, and something to think about if that is the case for your specific child and their needs.
I just wanted to quickly add, I was just thinking a little more about, kind of creating this positive experience for Emerson in going to the dentist, and also our choice to go to a private provider versus the hospital setting that we started at, was the environment of the dentist office. was really important to us as well. The provider that we chose, the office looks nothing like anything medical. It's a really beautiful office. It's colorful, it's kid friendly. It's got books and fairies and color and teepees, and it's a fun place to go. It's got a fairy garden outside the window of the office that we sit in where we get our teeth cleaned. And so having that environment be really positive and fun and non-medical was also really helpful, I think, to us grounding in this being an overall positive experience of going to the dentist.
Thank you for sharing that. I think that's a great point. Is just kind of doing what you can with the environment to try to make it as comfortable as you can for your child. The last thing I want to get into, and I'm really excited for us to talk about this, is navigating orthodontic care and procedures. And Dawn, if you don't mind getting us started and just sharing about Emerson's journey with orthodontics, that would be great.
Of course. So I was interested in orthodontics pretty quickly once Emerson started getting her adult teeth. Her baby teeth were straight and perfect and all lined up, and then the adult teeth started coming in and they were a little wonky. And I never had braces, so I didn't know that much about it, but I was very interested in it. And started asking her dentist about it, and she was always like, "Oh, it's not time, but we can talk about that." And she said probably Invisalign, and kind of made some speculations about stuff. And I'd done some research and kind of been watching other journeys of kids I knew with disabilities who had orthodontics. But it was last year, I guess, we finally decided to pull the trigger, and her dentist was really supportive and really had an orthodontist in mind that she wanted us to go to, that she was familiar with, that was, seemed a bit progressive in her treatment style and open to treating kids with disabilities, or not afraid of it, certainly. So we bit the bullet and went and saw this orthodontist, and it was great. She was very open to helping Emerson and accommodating us how we needed it. She clearly hadn't really ever had a patient like Emerson in a wheelchair. Her office certainly wasn't set up for it. Her staff, it clearly was very new for them to have a patient with this level of disability in their office. That said, they were just really open to it, and they're like, how do we do this? Like, they asked me the questions like, what do you need from us? Does she stay in the chair? We had to start, from scratch with all of that. One of the most difficult first things we had to do was the X-ray, and the X-ray machine that they use to get that kind of information is definitely not conducive to a mobility challenged child or the family. So again, it was just one of those where we all just kind of chipped in as a team to figure out how we could make it work. I definitely needed to wear a yoga outfit or something that day because I got a workout, holding her and her head with the machine that goes around her and staying out of the way. And, Emerson doesn't have head control. She has dystonia, so she's twisting and can't hold herself up and all this stuff. So, it definitely was not an ideal situation, and it was much harder than it would be for most. But we had an orthodontist that was willing to try, and we were willing to try, and we all just jumped in together and we got what we needed to so that we could move forward with that. But ultimately the decision was made to just focus. And I think it goes back to what Matt was saying about, prioritizing, like in an ideal world, we do all of this, but let's focus in on what, the biggest priorities are right now. And so for us, we decided to focus on the top 4 front teeth, which were the ones that needed the most attention. And that seemed manageable. And so, that's what we did. And we ended up choosing to go with braces over Invisalign because the orthodontist determined that she thought that would be a much faster and more effective way to go about rather than Invisalign, which is a little bit slower and a lot more in and out of these, devices. And she just thought Emerson would tolerate it better. So I hadn't envisioned that we would have this mouthful of brackets and wires, but we did. And it starts out slow, so it starts out with just the little brackets on the teeth, and I get a lot of questions about if it's painful, if it, how she tolerated it and all of that. And I really think that she had a pretty similar experience to what most kids who have to get braces have. Initially there is some discomfort. We were able to use, Tylenol or Advil, an over-the-counter pain reliever in the initial, day when it was first uncomfortable, but it pretty quickly resolved the discomfort. It started out, just with some brackets on the teeth and one wire, and that was pretty easy. Subsequently, every, about 6 weeks, we would go in and she'd add on a little more, and it would get a little more difficult because then you're contending with, wires that may be poking out, and we had to use lots of wax. And, with a child who can't control her secretions and isn't, she receives all of her nutrition and meds by G-tube, and, so all the oral stuff is hard, and she doesn't have a whole lot of oral control. So, and then she also doesn't have head control. So making sure that she's not in situations where her head's going to drop quickly. And, now she's got this metal in her mouth that could cause injury. So it definitely adds a different layer to things. We had to stay on top of it, but there are things that you can do to make it manageable. And Emerson was on board with this. She wanted to have braces, and she was in 6th grade when she had 5th, 6th grade, and most of her friends also had braces, and we're dealing with that too. So it was challenging at times, but it was manageable. And I don't think that we probably had another layer to deal with that typical parents don't have to deal with, in terms of like controlling the pain and the poking of wires and all that sort of stuff. And Emerson uses AAC to communicate, but she's not, she can't tell you. A lot of times she can tell you something's wrong, but you don't know what. So, figuring out exactly what's wrong or where it's poking or all of that sort of stuff, that's an extra layer with a child who uses alternate communication or all of that sort of stuff. So I guess the thing that I would say is, it was 6 months, and by the end of 6 months, I was done. I was done with braces, but we got what we needed in that amount of time. So I definitely feel like it was worth it.
And I think just the only thing from my perspective to highlight is that when goals are aligned from the very beginning, and I think through all of the different experiences that you've had up to the point of getting braces, I can imagine those were all really helpful to be able to A, know what to expect, but B, also to communicate things that have worked really well in a different environment. So you can push those things forward in the new experience. But it comes down to, you know, there's always variations in any type of treatment or procedure that can be done. And thinking about what type of procedure will get to the end point that we are looking for, I think, and especially when it comes to braces or to alignment and to get things in different teeth in the right place, kind of considering all those factors are just really important in any good treatment plan. But you truly sound like a superhero, Don, that you're ready for uh, another job in a dental office, kind of helping out with other folks as well. But I know that the parents that are listening are already doing a lot of these things and a lot of the different appointments that they're going to. So, notice that, this is truly remarkable to hear, even from my perspective. So thank you for sharing.
And I just want to thank you both so much for sharing today. I know that all this information that we talked about, everything we went over, is just vital information that's going to help so many other families. So again, I just want to thank you both so much for being with us today. Thank you.